Who is at risk for urinary health problems? Have you ever wondered who might be at risk for urinary health issues? Understanding the risk factors can help identify those who may need extra attention. Urinary health problems, including bladder health issues and bladder cancer, can affect a variety of people. Certain factors can increase the likelihood of developing these conditions. One significant risk factor is age. Older adults, especially those aged 55 and above, are at a higher risk for urinary health problems. Bladder cancer is more common in this age group. Gender also plays a role, as men are more frequently affected than women. In fact, bladder cancer ranks as the fourth most common cancer in men. Another major risk factor is smoking. Tobacco smoking is the single biggest risk factor for bladder cancer and other urinary health problems. The harmful chemicals found in tobacco can damage the lining of the bladder over time. Exposure to industrial chemicals is another concern. Workers in industries that use dyes, rubber, textiles, and certain manufacturing processes may be at increased risk due to exposure to carcinogenic substances. Chronic bladder irritation or infections can also contribute to urinary health issues. Long-term bladder infections, chronic inflammation, and prolonged use of urinary catheters can increase the risk of bladder problems and cancer. Individuals who have undergone previous cancer treatments may also face a higher risk. Certain chemotherapy, agents, and radiation therapy to the pelvic area can raise the likelihood of developing bladder cancer. Race and ethnicity can influence risk as well. Research shows that white men are statistically more likely to be diagnosed with bladder cancer compared to men of African descent. Lastly, neurological conditions affecting bladder function can put individuals at risk. Those with spinal cord injuries or neurological disorders may experience urinary retention or requiring catheterization, increasing the chance of infections and complications. For those at risk, regular monitoring and early detection are crucial. Symptoms such as blood in the urine, frequent urination, a burning sensation during urination, or persistent infections should prompt a medical evaluation. Avoiding smoking and limiting exposure to harmful chemicals can help reduce risk. Proper management of chronic bladder conditions and infections is also essential for maintaining urinary health. For people with spinal cord injuries or mobility challenges, evolving bladder management strategies can help maintain function and reduce complications. Clean intermittent catheterization or urinary diversion are examples of these strategies. By understanding these risk factors, individuals can take preventive measures, seek early screening, and receive timely treatment to preserve bladder health and reduce the risk of bladder cancer. Always consult healthcare professionals for personalized advice and diagnosis.